Be a bright spot. You never know when a smile, compliment, or kind word can change a person's day. Good afternoon, and welcome to Bright Spot, a virtual discussion bringing you a dose of inspiration while normal conversations about mental health and substance use disorders presented by CNS Healthcare. My name is Nancy Gandolo Spearman, Chief Marketing and Outreach Officer, your host. We want everyone to know your mental health matters and it's okay to not be okay. Today, Michele Reid, MD, the Chief Medical Officer at CNS Healthcare, will be joining us. She will be talking about seasonal affective disorder, mental health during the winter, and Black History Month. Dr. Reid, please tell us a little bit about yourself, and then let's dive right in.
Hello, Nancy, and thank you so much for having me. I am Chief Medical Officer here at CNS Healthcare, and I've spent my entire career working in the community mental health system here in the great state of Michigan. And I'm really passionate about certified community behavioral health clinics and the expansion of mental health services throughout our community. So this has been a big excitement for me over the last several years.
Well, welcome. Let's dive right in. Perhaps you could tell us a little bit, before we get into the questions we have listed today, could you tell us a little bit about what a certified community behavioral health care system is?
Yes, CNS Healthcare has received this special federal designation to say that we are a site in the community that provides a full range of mental health services to people regardless of their ability to pay. We specialize in working with people who are uninsured, people who are underserved, or people who are underinsured, and especially focusing on access to care for veterans, children, and the LGBTQIA+ population. So it's a place in the community where you can get in-person or virtual services for mental health disorders and substance use disorders, regardless of your ability to pay. And we partner with numerous healthcare organizations in the community to also be able to offer physical healthcare services at our site. So that's another exciting part of being a certified community behavioral health clinic. There are hundreds of them all across this great nation, and we're very excited that the federal government has expanded them for another 6 years, and we're looking very much forward to the state of Michigan expanding the certified community behavioral health clinic demonstration state so that we can add even more sites in Wayne, Oakland, and Macomb County to get better access to mental health and substance use services for the people in our communities.
That's great. So why don't we dive in? How common is seasonal affective disorder?
Well, I hear people talk about seasonal affective disorder. I hear people talk about the winter blahs. I hear people talk about the winter blues and about winter mental health. So just to say, we live in Michigan, we don't have a lot of sunlight. It's not unusual for many of us to feel a little blah in the wintertime. So you have less sun outside, more likely to be going to bed early and not spending as much quality time outside with nature. So it's not unusual for us to feel a little blah in the wintertime. And I always say the best prescription in the wintertime is to go somewhere warm between January and February and March for about a week, and that will help. So if you can get somewhere warm outside the great state of Michigan, that would help you. But if those feelings of blah and sleeping too much go on for more than several weeks, if it's interfering with your school or your work, or if you're feeling down enough that you're even thinking about possibly thoughts of wanting to die, or why should I live, or feeling hopeless, helpless, or worthless, this really could be a sign of depression. And in fact, seasonal affective disorder is just one of the variety of forms of depression, very common. I always say depression is like the common cold in primary care. That's the most common psychiatric disorder that we see. And in fact, seasonal affective disorder is just one form of a depressive disorder. So if your winter blahs are lasting longer than 2 weeks, and it's significantly interfering with your functioning, and you can't sleep, and you're not eating, or sleeping too much and eating too much, it could tip over into something that we're calling the seasonal affective disorder, which is a type of depression.
And how would one seek treatment for that, and what are treatments for that?
Well, I think the best place to start for any treatment for a mental disorder is having a great relationship with your primary care provider. At CNS Healthcare, we work with the Detroit Community Health Connection and Honor Community Health, two federally qualified health centers, to be able to offer primary care services to people we see. So with regard to all forms of depression, about 80% of depressive disorders are actually treated by primary care providers. So a good place to start is with your primary care provider. What are the treatments for depression and seasonal affective disorder? First of all, let us say that psychotherapy is the gold standard. So talk therapy is one of the best things to be treated for depression. Also, being able to move more. I mean, just the fact that we're not moving too much in the wintertime, moving more, a little bit of outside time, sunlight is important. They've also found a correlation between low vitamin D levels and depression. So again, working with your primary care provider and make sure that your vitamin D levels are normal, and taking vitamin D supplements if that's indicated. And also light therapy. You know, there's a bright light therapy. You can order them on Amazon. They're at least 10,000 lux, and you get up in the morning, first thing, put your light on when you read your newspaper or look at Facebook or Twitter or Instagram, or when you have your morning coffee for half an hour, and that's been helpful. And for some people, when it's more severe, antidepressant medication may be indicated for the treatment. One thing, I did go to a conference this past year ago, and I went to a workshop called Nature Therapy, and that nature therapy, getting outside and seeing nature, is in fact something that can be very helpful for our mental health. And this morning was trash day on Tuesday, and when I was taking the trash out, I made sure I paid attention. There was no sun out, but looking at the sky and appreciating the trees in the neighborhood and the animals that were running or scurrying around. Nature therapy is also something that's very beneficial for the winter blahs and also in general for our overall health. And I can't emphasize enough that regardless of whether it's a mental or physical health problem or substance use problem, healthy eating is one of the keys to maintain your health. And the best thing I could recommend is to eat the rainbow. You know, eating those various colors of fruits and vegetables is extremely, extremely important. And most Americans do not get the required amount of fruits and vegetables. So that also, I think, having a healthy eating plan that includes, you know, your purple, green, red, yellow, orange, white, and brown fruits and vegetables is essential to maintaining your overall physical and mental health.
Thank you. If you are just joining us, this is Bright Spot, your community connection to wellness, presented by CNS Healthcare. We're speaking with Michele Reid, MD, about seasonal affective disorder and mental health during the winter. Dr. Reid, let's transition. February is Black History Month, a month that honors the triumphs and struggles of African Americans throughout U.S. history. Let's talk about you for a minute. What's your biggest inspiration and reason for deciding to work in mental health?
I would have to say it's my parents. Both of my parents were psychiatric social workers at the graduate level who actually were on boards of community mental health centers. My dad taught in the Graduate School of Social Work at Wayne State University, and my mother was a social worker for the Detroit Board of Education. So sitting around, listening to them talk about, my dad would talk about his student placements at Pontiac State Hospital, and my mother would talk about the things that were happening in and around Detroit with regard to access to mental health services, and hearing them talk about the community mental health boards. Actually, my mother was on the board of what's now called Southwest Solutions, and actually helped write the original federal grant that got them their federal funding. So just sitting at the dinner table and hearing those things made me interested. My father also had a private practice, and he practiced marriage and family counseling. And so we would have to be quiet. He would have the clients would come in, the families, and go into the den, and we'd have to be quiet when he had a client. So actually seeing him in private practice, hearing about him teaching at Wayne, and my mother working with the school children in the city of Detroit made me interested in community mental health. So I think definitely it was a direct line. I think I was born into the community mental health system, and I went to medical school with the intent on becoming a psychiatrist. So I think I was influenced very early on. But if you ask me, how did I get interested in being a physician? When I was very young, I used to watch a lot of TV, and I used to watch these movies about Albert Schweitzer and see him, working with various people. And I was about 5 years old, and I said, I'm gonna be like that. I'm gonna be a doctor. So actually television was what motivated me. And I think also participating in the Girl Scouts. I was in Girl Scouts from elementary, K through 12. My mother was a social worker. Her first job out of social work school was in Minneapolis, Minnesota, working for the Girl Scouts. So we were a scouting family. And I think Girl Scouts taught me leadership skills very early on and got me interested in administration. And my mother was an administrator also later in her career. So I got interested in administration there. So I would say TV, movies, Girl Scouts, and my parents were the biggest influencers, I think, that wound me up where I am today. And I have spent my entire 40-year career working in community mental health.
It's amazing. Shifting a little bit, what does Black History Month mean to you, and how would you like to see it celebrated?
Well, when I think about Black History Month, I think about my dad. And I mostly think about him because my father was a Tuskegee Airman. And I think about the contributions that African Americans have made to this country. And I just watched this movie called Devotion, which was about the first African American naval aviator. And being able to celebrate those stories and know our history, I think, is just phenomenal. So my dad, when he was in college, he got called up for World War II, and he got a deferment to finish college. And when he finished college, he went in and he was an air traffic controller in Tuskegee and traveled all over the world as air traffic controller. And I actually have an uncle on my mother's side who actually was a pilot. So I just think about Black History Month, which we should do every month, but to lift up the stories of African Americans who have contributed greatly to the United States. And I would say if anybody has not seen this movie Devotion, please see it. It was just an excellent, heartwarming story about the first Black naval aviator. So that was very exciting for me. So I think I see that very personally, and it really touched me. And seeing that movie over the Christmas holidays with my family made me think about my dad and his time as a Tuskegee Airman.
Great. I'm adding that movie to my growing watch list. Shifting a little bit about stigma, studies tell us that Black Americans are less likely to seek mental health services than white Americans. 25% of the Black population and 40% of the white population. How do we solve the stigma problem and so that everyone will get healthcare, but especially the Black community?
I think as being a certified community behavioral health clinic, we have to do a needs assessment in our various communities. And in the needs assessment, we did find that stigma was part of what was holding people back from accessing services, but it was also things that are probably obvious that you may not think about. Transportation is one of the factors that made it difficult for people to get services. So we're looking at the social determinants of health, and it really looks like that poverty is really one of the number one factors that may be contributing to Americans of all sorts to not get the needed health care that they need. I mean, we live here in the Motor City, and if you don't have a car and gas money to get a reliable transportation to get from point A to B, this is the problem in the community we live in. We're not like, I've been to major cities like San Francisco, New York, Washington, D.C., where they have abundant, the MARTA or the trains that you can get on, the subway and get from point A to B. I've ridden on the subways in all these cities. We don't have that type of speedy, quick access to low-cost public transportation, and it really affects us. Even in some of our communities, they're not even part of the smart bus system. So, there's difficulty getting from point A to B. So I think transportation is one. I think poverty is another factor. We talked earlier about the food that people are eating. So if you don't have access to fresh fruits and vegetables in your immediate neighborhood, or the cost is too high. All of these things are a huge factor for people not being able to gain access to healthcare. And I think at CNS Healthcare, we have worked really hard with the stigma. We have our empowerment team that actually goes out into the community with a number of people who have a lived experience with mental health and substance use disorders to talk in the community and have conversations with students at universities. We've been out to churches and schools and on TV and the radio talking about the stigma and lifting up people who have had mental health issues and how they've overcome those issues. We participated at Kevin's Song. I was over the weekend at two days at a conference talking about suicide. So the more we can be out in the community having conversations about mental disorders and about, help is available. Mental disorders are treatable. People with mental disorders can and do and lead productive lives, and help is available.
Just expanding on that, what can we do, those of us that work in mental health or friends of ours, to lessen the mental health stigma, other than, talking about it, attending, many trainings on suicide and getting people to change the language around committed suicide versus died by suicide and things like that. What else can we do? What else can the audience do?
I think exactly what you're saying is just knowledgeable. So we just did some recent radio shows, and I called one of my relatives in Ohio to watch it. And she told me she lives in Ohio. She didn't know anything about 988. So she felt it was some very useful information. So really being out there to use your own social media networks, your Instagram, your TikTok, and other things to like CNS Healthcare and to spread the word, because the information is just not out there. That 988 line for crisis, it's like, we want to teach people, like if you have a heart attack, you call 911, or a stroke, call 988 if you or a family member may be experiencing some mental health issues, and that's a place to get some help. So I think getting the information out there in usable format so people can share it all around. And our reach is, again, not just in the state of Michigan. This relative of mine lives in the state of Ohio and was amazed to know that the 988 number had launched in July and she didn't know anything about it. So I think that's important. And I'm increasingly learning about the value of social media because this is where a lot of people get their information. I get up every morning and I do the New York Times mini crossword, and I read the New York Times and I watch some cable news, although since the pandemic, I limit myself to 30 minutes a day. But we really are working out there to look at alternative means of communication to meet the people where they are. Not everybody is reading I still get a hard copy newspaper delivered to my house. Not everybody is reading the newspaper. So people are getting their information from very different sources. And I think the people who are listening and our staff, number one, like CNS Healthcare, tag us on your Instagram, Twitter. I understand now, even Nancy, I heard that we're going to be on TikTok if we're not already. So I think embracing these new technologies to reach out more into the community to elevate the mental health topics, I think is key. And also, I'm over here at our counter office today, and we're actually doing a training on mental health first aid. So there are other sources out there that additional training, applied suicide intervention skills training, mental health first aid, that there are many opportunities to take a deeper dive into mental health topics and become more knowledgeable about them. So I'm really excited about that, and us being in the community, bringing this valuable information forward. And I think, again, the faith-based strategy is also something we're working on. People are more likely to look for help for mental disorders in various religious institutions. So what we need to do to really work out there with those ministers. So if you're a staff member or a person out there and hear us, contact us at info@cnshealthcare.org. Invite us out to your synagogue, to the mosque, to your church, to your local school or your fraternity or sorority. So we really are looking for them to help us find more places in the community where we can get out. So contact us anytime at info@cnshealthcare.org, and we'll be glad to arrange to come out and talk with you and your community organizations about spreading the word about mental health.
Wonderful. Thank you so much for joining us today. Before I let you go, could you just give us one sentence of your favorite mental health tip and how to stay healthy this winter?
My favorite mental health tip for me, we did some tips during the pandemic, and one of them was to limit your screen time. And so what I have been working on that has worked with me, I'm cutting down on that screen time, and I am listening to the books on tape with Audible. So reading more and consuming less news has been excellent for my mental health. And number two, the nature therapy I talked about earlier. I've been making a serious effort to get outside, even if it's just for a few minutes, and appreciate nature. So reading more and appreciating nature are my two tips.
I love those two tips. I love to read and I love to be outside. And I will confirm that CNS Healthcare is on TikTok. Thank you again for joining us, and we look forward to having you as a guest again soon. We hope you continue to mark your calendars to join us the second Monday of every month at noon to discuss feelings, struggles, and finding one's way. If you have a topic you'd like to hear, please note it in the chat or comment on this video. Please remember to be a bright spot. You never know when a smile, a compliment, or a kind word can change a person's day. Thank you for joining us and have a great week.